Here in the Senate, we also have an incredible responsibility to not only make sure our country is protected, but to also ensure we live up to the promises made to our veterans. These men and women are trained and have selflessly sacrificed in defense of our freedoms and our way of life. However, we must ensure that our veterans are prepared to transition back to civilian life. They deserve nothing less than the benefits they were promised and a quality of care we can all be proud of. Unfortunately, that has not been the case. According to the VA, there are approximately 22 veteran suicides per day. We hear this number from time to time, but think about it. 22 veteran suicides per day. In November 2014 testimony before the Senate Veterans Affairs Committee, the VA's chief consultant for mental health said, the average wait time for a mental health appointment at the VA is 36 days. We can and must do better for our veterans. If a non-VA mental health care professional can reach a veteran 1 day, 1 week, or even 2 weeks earlier than 36 days, Congress nor the VA should be an obstacle to affording a veteran potentially life-saving mental health treatment. Veterans themselves are the only ones who know their mental health limit, and a veteran should receive the benefit of the doubt at where that limit is, not the VA. This is an issue that impacts all eras of veterans. Since coming to Washington, I've heard from many veterans on this very issue. One veteran in particular from the Vietnam War era admitted that he had twice attempted suicide. This veteran felt like he didn't have anywhere to go. We have to do better. As my first piece of legislation in the United States Senate, I am introducing the Prioritizing Veterans Access to Mental Health Care Act. This legislation provides an option for our veterans to receive mental health treatment until they can receive comprehensive mental health care at the VA. This authorization for mental health care provides a backstop other than the emergency room for our veterans. Ultimately, the ER should not be considered a backstop for delayed mental health care at the VA, as most veterans who seek mental health treatment at emergency rooms do so when they have reached the limits of their suffering. There is no acceptable VA wait time for mental health care for our veterans. The limits to how much suffering a veteran can endure simply cannot be accurately measured by the VA or by any medical professional. Specifically, this legislation puts veterans' mental health care first and foremost, provides a backstop to VA mental health care, and prioritizes incentives to hire more mental health care professionals at the Department of Veterans Affairs. The Prioritizing Veterans Access to Mental Health Care Act does several things. First, it amends the Veterans Access, Choice, and Accountability Act of 2014 to where a veteran is instantly authorized non-VA care if the veteran provides an electronic or hard copy statement in writing that he or she is not receiving adequate or timely mental health care at the VA. This eliminates the 40-mile and VA wait time triggers for mental health care under the Choice Act. Second, it prioritizes incentives for the hiring of mental health care professionals at the VA. And third, it provides the VA 90 days to enact the program. I hope this legislation will receive broad bipartisan support because ensuring our veterans have access to the mental health care they deserve is not a conservative or liberal concept. It's not a Republican or Democrat idea. It's an American value. If we do not stand up for Americans' tenacious survivors, who will? Thanks to these brave men and women, we are able to stand on this floor and fight for our beliefs and ideals. These veterans fought for us and defended us tirelessly. They endured more than some of us can ever imagine. The invisible wounds of war can no longer go unnoticed. Now it is our duty to do all we can to thank them and ensure they have access to quality mental health care, the health care they deserve. God bless these men and women, and let us strive to do better for them. With that, Mr. President, I yield the floor and note the absence of a quorum.